Okay, welcome back. We are looking at spine facet cysts again. This is the second part in a series. We had the initial one last week where we looked at the important anatomy that's related to facet joints and what happens when you get a cyst, the involvement of adjacent nerves. In this one, we're going to be looking at the CT and MRI appearance of facet cysts and what the typical look of them is like on imaging. This was part of a series we did with Hitachi Medical Systems Singapore on spinal imaging. So what do we look for? So we're going to look at both the MR and the CT appearance. On MRI, basically what you're looking for is a cystic structure. This is going to be the most common appearance. We'll look at some variations on this, but the most common appearance is going to be the cystic appearance. So what you're looking for is usually a pretty well marginated, so it's got this low signal rim. This is a T2 weighted sequence, so the cyst is bright. This is T1, cyst is low signal. And this is a very typical appearance of a facet cyst. What about if you gave contrast? So if you give contrast to a cyst, they may or may not enhance. And the reason they can enhance is because the cysts are actually continuous with the joint space, with the facet joint space. So you can get synovialization and you can get normal enhancement. So usually that enhancement is peripheral. And the other important thing is because the question will always come up, is this an infected cyst? Is it inflammatory? Is it infected? If there's and we'll look at infection towards the end of this talk, but one of the things is that when you give contrast with infection, generally you will see the peripheral soft tissues around the cyst also enhancing, or they will have inflammatory change. It would be really unusual to have an infected cyst and not have any soft tissue changes around it. So that can also help you. But I think the thing is that if you happen to give contrast, now something like this, you really don't need to give contrast. But if you happen to give contrast and you see enhancement, it shouldn't put you off calling it a cyst. So given the location of it, the appearance of it, the fact that it enhances, it's still a cyst. Some variations in it, so they can be septated. If I go back here, this one, it doesn't really look septated. There's a bit of heterogeneity in its signal, which is normal. But if we look at this case, we've got septation within the cyst. Now again, that can be found. It's not abnormal for the cyst, so this wouldn't be something that you would think I'd say, oh, it's got septation, maybe it's tumor. Septation can be seen with cysts. What about CT? So CT is not as useful because the contrast of CT is the same. So the cyst will be the same as what's in the dura in the thecal sac. So facet cysts are often missed on CT, but there are a couple of things that can help you, which are not common, but can help. So if you see air within the canal, so we've got a nice rounded structure here with air. We also got air within the facet. So this suggests that there is a cyst within, this is related to that. So this air has leaked out of that facet joint, is now sitting out here. So this is a good appearance for a facet cyst. The other thing that occasionally you will see is calcification of the cyst, and this will be seen better on CT than it will be seen on MR, and we'll go into that in a moment. But on CT, for facet cysts, predominantly, if you see gas within the thecal sac and they've not within the canal, and they haven't had recent surgery, then you need to think about a facet cyst, especially if it's right up against the facet joint, but they can track. And if you see the sort of rounded calcification around the region of the facet joint, again within the the spinal canal, this is also a calcified facet cyst.